That would have been a sudden death. Just like the one before that would have been a girl with addictions that we written off. Mother would have been somebody in trouble, and that guy would have just carried on his merry way till he hurt or killed somebody. You know, stepping on toes. Another example. We got a psychologist that's at the table, and he's supposed to do, we have a problem. We have a person that's a dangerous risk to reoffend getting out of our institution, and we have City of Fort jails, so we got lots of jails. Getting out of the institution, they have a problem. They have nowhere for this young fella to live, and he's had a lot of trouble. He's had trouble with the law, he's extremely violent. So they know he's going to reoffend. So to get him housing, health comes in and says, we have a house for him, but he has to be assessed. He has to be assessed before he can be in that house. Okay? The answer at that table, social services and health step up and say, you know what, we'll get him an appointment 2 days after he gets out. 2 days after he gets out. Well, we got a place, he has no place to go, he's extremely violent. Do you think he's going to get in trouble in those 2 days? Okay, that's not good enough. Somebody fires back. We need to do an assessment on him. Okay, doctor's going to go to the jail after the meeting. Goes to the jail. Turns out his past wouldn't work. The jail wouldn't let him in. They wouldn't let him in. Doctor comes in, that's it, he can come to my office. And the group looks at him and says, you're a doctor, but you don't run this place. Get back up there and we'll fix that. Long story short, they do the assessment when he's in an institution. Go figure, they have medical staff there. And this isn't pointing fingers. We're all to blame for this. So don't look like I'm trying or think that I'm blaming one or the other. These people step on each other's toes. This person gets a place to live. They get him in, they get him under medication. He's got a whole plan, and now this guy had a track record this long for us, no longer been in our system for a period of about 5 months. But he's going to be back, because at the end of the day, these aren't always going to work. So looking at his update here, think about this. You've all read books, you know, Bratton, Broken Windows Theory out of New York. This windows are up there just to basically say, not about the broken windows theory, but the bigger the job is, the more windows are broke, the bigger the job is. So why are we going to wait till all the windows are broke before we take action, when we know that right now the economic crisis and the relationship between the future of policing and the academia telling us the relation to the financial market? Now is the time for change. We're in a unique opportunity. We're positioned well that we can make the right choices. So this is the thing here. Think about this. Our system presently is like that. Everything's coming in, feeding into the system, and it's become a bottleneck. And you take the thing on the top, alcohol, probably, Matt, 80% of what we're doing, pretty much standing right across the base. So that's a contributor to what we're doing, that alcohol. And I know Doctor and I differ a little bit on his opinion, but if you really think this is a money issue, in my opinion, put a 1% tax on alcohol, focus it for targeted evidence that works on the social side of the house. So in government, when there was social infrastructure, domestic infrastructure problems with police pipes and pavement, that's how the mayor of Montreal described it to me in 2004. Pipes and pavement, they give 1% rebate on GST, had to submit their plans, and they started to fix that. If you put the value of the family and the social economy in that same value, targeted some money, if you needed new money now, there's a way to do it. Yes, it has to be targeted because there is lots of tax on alcohol, and sometimes it just gets lost in the coffers. So there needs to be better accountability in relation to that. But if a case of beer, a case of 12, is now $23.23 versus $23, does it really matter? Who's going to stop drinking? And if they stop drinking, is that a bad thing? I was in a Iqaluit 3 months ago. It was $8 a beer, and they weren't drinking any less. So how do we get rid of the bottleneck? Well, the way to do that is to slow down the inputs. Take the 73% of this stuff out of the system, slow it down so the courts and all those things that are designed to work on the other end can actually change it. One of the chief justices, and I'm not going to use the word here, told me in one of the provinces here recently that our system is full of 90% poor souls and 10% blank holes. And that's how he described it. And I don't use the language, but you can figure it out. But what he's saying is we need more information on the 10%, and we need less of the 90% in our system and deal with them more effectively, because a lot of the cases, they're not criminal. And if we can get them before they turn to criminal activity, then we can actually make a difference. So this is what I talk about. When I say soft on crime, back to the hard soft on crime, this is smart on crime. This is thinking different. It's not changing the back end, because in the back end, as soon as you talk to corrections, they get their defenses up because they think that what they're doing doesn't matter anymore. It absolutely matters. Those programs in those institutions are the foundation for rehabilitation, and the federal institutions in our country have done a very good job at that. They have some great programs. It's early intervention and systemic change. It's evidence-based, it's intelligence-led, It's front-end interventions. Basically, here's some of the results that we've seen up to date. So we've had 308 projects in our hub, 301 done, 689 tasks, 40 housing, 33 maintenance, 16 domestic related, 31 mental health, 47 addiction, 106 child welfare, 35 miscellaneous. Look at that right column, the police in the room, and say, how many of those are the responsibility of the police? How many of those should we own? I think a pretty good answer might be none. But right now, we're owning the majority of them. So we need to change the focus. So when we've done this now, our calls for service were down. And keep in mind, my crime stats were never down. They're always because of the age demographic going up. Crime stats were down 11.3. Last quarter, the emergency room visits in the hospital were down 10%. Now, we can't say this is exclusive to the program, but there's some reasonable similarities that a common person could think that there might be a relationship here. And that's something that we need to study further. Crimes against person, the number of victims, back to Dr. Waller, measuring the number of victims are down 9.1%. And we did the reverse. We recorded everything. We changed from what we do because we could have did a reorg in our organization and start taking things off the table to drop our calls for service. But because we were a small community, we made a conscious decision to record everything 3 years ago so we could actually figure out what drives us. Public prosecutions were down 12%. Families diverted, social services were actually up to 42. 40 families diverted is 1 month social services work for their family workers. So in the course of 11 months, they saved 1 month's work. Think of the savings. Think of the whole dollar, think of the savings. So we went to Scotland. Scotland had a hub there, wasn't connected to their core. They basically had 2 different things running almost at arm's length of each other. We came back from Scotland, and basically what we did is we married the 2 together, so we put 1 person in charge of both of them, making sure we're looking at systemic, long-term stuff, 24, 48-hour response, those things that our citizens are getting frustrated with, that need to get off the table before they become problematic. We put a measurements governance board into it, and actually when we were in Scotland, they asked us for a provincial organized crime strategy. So we used our provincial organized crime strategy and populated with all the other directors. Executive committee meets twice a year. OCC, the operational, setting the goals and objectives, meets monthly right now, and they get to be able to draft what those local and regional priorities are. So we have to build the whole franchise. So we got the province to come on board. We asked them to pay for the 454 positions, which is basically the leadership piece, the executive director, which is a secondment, 2-year secondment. Right now, it's our bylaw manager. The next one could come out of health, social services. It has to obviously change the leadership to make sure everybody's interests are looked after. 1 assistant, executive assistant, and 2 analysts. 1 analyst trained tactically to make sure we deploy properly. 1 analyst trained on social return on investment, which we're bringing in some people that are basically accredited for it coming into our police service this month at the end to basically teach us. So what social return on investment is the soft side that we can't measure. What an investment here will look like, and it's an accredited program that's come out of the UK. We've asked the feds, and I know it's going to budget, and we hope, because we see everybody has to come with a piece of this. We've asked them to do the one-time capital costs. If they could pay for this, what we're basically doing here now is building a franchise. If they could come for this, the one-time cost, which isn't that big, now they have all the operational money to get up and running. What gets measured gets done. Obviously working on the measurement piece. Building the franchise, think about this. Same building, same M on top, same structure, same cooking system, hey, same clown, but check the menu out. The ability to operate at a local level, to drive down local priorities, exactly what a franchise does. We've asked all the agencies to reshift and rethink how they deploy their resources. They need to bring their own resources to the table, not ask for additional funding. In addition to that, they have to bring $25,000 each to the table for operational money. So now we have enough operational money that this will never be in jeopardy. The staff are there and they're committed to a governance board. Province brings in the brain piece, so the measurement gets done. Get the feds to bring it. All of a sudden we have a structure where everybody's working in the same direction. If we want to get more technical than that, we've offered the piece to say that all of our NGOs and CBOs should have a sign-off piece by the core. I don't mean a funding piece, but a sign-off piece. We have tons of NGOs and CBOs in our communities that the accountability mechanism in there, and government doesn't know how to track them. So if you have a sign-off piece, that'll make sure that they're getting what's done at the local and regional level, but more importantly, the ones that fight for funding will be the ones that get funded first because they're effective. As you can see, we've done a little bit of work on this. So basically, all the things, sharing policy, I can get into that through questions, mandate letters, memo of understanding, sustainable funding. Basically put all that into a box. Basically box it up, build your franchise, community mobilization. One core can support 3 hubs. So in Toronto, what that could look like, you could have one core where everybody's there, 3 hubs in areas that might be a bit of causing trouble to the services. Drive those in. Now there's an accountability framework right throughout the system. They're not moving around the system and being to avoid. It's all in the system, and now everybody's full. For us, we can put them in northern Saskatchewan where they have trouble sustaining the resources, and we can provide the infrastructure and support, and you can basically build them wherever you want. So basically, better solution, antisocial behavior. As I mentioned, the social return on investment. And basically, let's put our minds together and see what life we can build for our children. That's it. I got the time in, too. There.